I'm on a mission, and we're going to get this fixed because this is a very correctable issue. We do not have to be here. I'm Alan Frederickson. I'm the founder and CEO of Signature Performance. I've always had a great personal interest in service. Healthcare has been a great calling for me from a humanitarian perspective. When I first got in that business, administrative functions were 10% of a hospital's budget, not 40%. You can't ignore 40%. Think for a moment. Instead of 40% of your budget being consumed for administrative functions, what if that number was 10%? The difference between 40% and 10% would allow a hospital to do much more productive things. Hire more physicians, nurses, healthcare providers, more equipment to better serve patients, lower the cost of care. One of the inspirations of starting Signature was to take the knowledge we had of how healthcare operated administratively, so fragmented and in silos, and see if we could collapse the fragmentation, collapse the silos, so those entities and departments and functions could work interdependently together, therefore more efficiently, more effectively. When we think about the work we do every day, we start with imagine if. Imagine a provider that can spend 80+% of their time with a patient or on patient care versus 50%. Imagine patients who have access to healthcare instead of struggling with access. Imagine a system that is easily understood and streamlined rather than confusing and complicated. We know that's possible. I have great respect for the complexity and the magnitude of this issue, and I myself have had moments and days of wondering, what are you doing? Where do you begin? I've had friends and colleagues of mine in the industry say, you're taking on a really complicated issue here. But realizing the impact it was having on patients and providers and payers and the cost of healthcare, I thought to myself, we can't be on the sidelines here. We need to engage. We need to be in the arena. And I looked at myself in the mirror and said, are you going to wait for somebody else to do that? It is time we solve this. Let's get after this.